Hi, good afternoon, and to anyone who is interested in following this ongoing look at the science around the COVID pandemic. And today I'm talking about that unscientific research around COVID vaccines. It seems as though, in order to get a paper published, you cannot include any questions around COVID vaccines. Why is it so unscientific to ask any questions, I wonder? So today I'm going to be highlighting a very important paper, which I've not actually gone through yet in complete detail. But the point about the paper is that I always start with a very simple question. Is this a paper that includes any potential risks that could occur around vaccination? And that's as simple as that. And so this one is a 3 year outcomes for post acute sequelae of COVID 19. Really important paper, big study, valuable information. I'll be coming to it in a second. And so if you are following, please remember to subscribe. If you're interested in more of our research, please look at the descriptions below and to follow us along. But let's just simply break down a few basic questions. Now, I don't know why the scientific community is afraid to ask really simple, basic questions. The first thing in science is that you don't assume anything is fine if you haven't actually done the detailed data analysis. So, in this case, they have done a very big research paper on the 3 year outcomes post acute sequelae of COVID 19. It was published on the 30th of May 2024. Included Eric Topol, one of the top researchers, and they were looking specifically at a group of the Veterans Affairs, U.S. Department of Veterans Affairs, and they followed them for 3 years, looking at the risks of death as well as long COVID type features. And this was a good sized study. It included 135,000 people who had infection. And critically, what you have to look at is also when they had the infection. This is what makes it so interesting. This study was looking at the early phase of the pandemic. So they started, I'll find it here for you in a second. They started in about March, between March and December 2020. You can see it here. So they were looking at cases. They were trying to identify them between enrolled between March and December 2020 in an era that predated the availability of COVID-19 vaccines and antivirals. So this is a cohort. Now, this is important. This is a cohort of people who were already exposed to the virus. Now, one of the things that I argue about, and I can't find any logical reason why anybody would disagree, in no disease do we, if you have natural immunity, there is I can't think of any disease where we then go on to vaccinate. That really is a simple question. And as I showed recently, when they utilized the data from Pfizer in a previous presentation, they included the fact that it would protect people who are already infected. There wasn't any science to back that up. And so there is a concept of hybrid immunity, but the reality of it doesn't seem to bear out when you look at real world evidence. So, places in the world that have very low vaccination rates, say, for instance, Papua New Guinea only had 4.5% vaccination rates. They don't have a problem now. So, natural immunity is robust. It is for every single viral infection, especially respiratory viral infections, where you can't train the mucosal immunity with an injection. So, this is the bit that caught my attention with it. So I always start and I do a search through the document to try and find if they include anything about vaccines. And all they said in this paper was that they were safe, but they didn't actually break it down. Now, here is why I think it's very important. So this is the same paper, and this is showing the difference in terms of outcomes, in terms of cumulative. This is cumulative excess deaths per 1,000 persons. In red is the hospitalized with COVID. in blue is the non-hospitalized with COVID. Okay, I'll make it a little bigger so that you can see it clearly. So, with regards to the hospitalized with COVID here, let's look at this one here first, the blue, non-hospitalized. You can see their deaths continue to rise. This is 30 days, 360, 720, 1,083 years. It peaked in the middle here. So they continued to die after infection. It seemed to peak about midway, started to come down, flattened a bit, and then gradually started to rise again over 3 years. When you look at what happened with the hospitalized patients, again, there was excess deaths in the hospital. That's where people died. It rose to a peak and then started to flatten. What's interesting is right here. This is about 360 days after. It suddenly shifts its trajectory and it continues on a much steeper trajectory over the 3 years. The question that I wanted to understand is this transition here representative of the point where we started to vaccinate the population? Because as I said to you before, what you've done here is that you have vaccinated a cohort that I would argue scientifically shouldn't have needed to get it. You focus on your high risk patients who had not been previously infected. That's who you should have vaccinated at the time. People who had already been infected, especially people who are at the front line, why would you do that? And then you would want to know, well, if we did that, what were the outcomes? And so you would then want to think, okay, well, if it was done, did you get better outcomes in the people? And I'm not talking about COVID infection, I'm talking about all cause mortality. Did you have better outcomes in people who were infected, natural immunity, and survived longer term over 3 years, the vaccinated versus the non vaccinated cohort? Really important question. And I think they could have the answer because I then went looking and I found a paper here, Vaccinating Veterans for COVID-19 in the US Department of Veteran Affairs. So they looked at this in 2022. And what they clearly pointed out here is up to that point, they only had about 50% of this cohort vaccinated. So they had 49.7% were vaccinated of that 5 million cohort. I don't know if that changed significantly because if by 2022 they hadn't been vaccinated, granted, the paper may have been representative of early 2021, the question still remains, what percentage of the cohort who remained unvaccinated, and we know that the high risk unvaccinated early in the pandemic had higher risk of severe poor outcomes. But for many of the high risk, they were already exposed and they therefore had natural immunity. So the question is, what were the 3 year outcomes between the cohorts? I don't know why that's such a hard question. I don't know why it's unscientific. And I cannot for the life of me understand how a paper doesn't include even to say what percentage of that cohort that they had, of the 135,000, had a vaccine. They mentioned the influenza vaccine in the supplementary report, so they do know to look at that. But why not just say, well, of this cohort, 90% or 100% or only 60% were vaccinated? That's a minimum. I think it should still have been broken out to look at the outcomes over 3 years. Very valuable to understand. You have to remember that we still have ongoing circulation of virus. It's important for us to be able to assess and analyze the implications of what it means going forward. We just need science. We don't need politics. And we don't need people to defend something unnecessarily. Your personal perspectives are irrelevant at this point, whatever that may be, whether it's you're vaccinated or unvaccinated. Let's just look at the science. And if the science shows that that cohort was better protected, wonderful. But if it shows the other way around, we need to know because it has longer term implications for the health of the people who had natural immunity before and were vaccinated, in theory, hybrid immunity. that is still a question that needs to be properly dissected. Hope you find that valuable. Have a great evening.